Okay, hi guys. So, a fairly common situation that can occur because people tend to sort of over-rely on scans a little bit too much, and again, sort of MRI scans and things are part of the evidence, but not all of the evidence. You quite often get a situation where someone will come in and say, I've had a lot of scans done, but the doctor or physio, radiologist, whoever it may be, can't find anything necessarily abnormal or certainly nothing that should be causing my back pain. So what's going on? So there's a very important kind of proof, if you like, a concept, the idea of using provocation testing. So those familiar with the work of Professor McGill knows that any McGill practitioner or clinician, before we sort of jump into giving recommendations and designing plans for people, we do a bit of investigation first of all to understand what's actually going on, and provocation testing is a massive part of that. There's also kind of understanding people's injury history and their sort of day-to-day patterns, so that you can look for sort of potential indicators as to what's going on during their sort of day-to-day and how the pain fluctuates. But the most important thing is definitely provocation testing. So what's provocation testing? Provocation testing is basically putting you into different positions and movements so that we can test one particular mechanic of a potential injury as we go with each test. And that basically lets us zero in on what's actually causing your pain. Because even if you haven't got anything that looks too untoward on a scan, and you've got back pain, provocation testing would help. But also sometimes people have got things that are apparent on a scan, but you might find with provocation testing that they're not actually causing you pain. So for example, you can have disc bulges and not necessarily have pain related to the disc bulge, if that makes sense. So we'll look at an example today, and it's an example that I had come in this week. So again, somebody had scans, nothing looks too suspicious on the scans. We run a provocation test, a particular provocation test, got quite a severe reaction to it, and that let us know exactly what the problem was. So without further ado, let's have a look at the provocation test, and I'll tell you what it means. Okay, so one of the key tests that we can run, or one of the things that we can look for, is tolerance to compressive load. There's two ways we can do that. One, we can do that with a kind of a constant compressive load, which would indicate potentially end plate damage, which is the connective kind of, if you like, sort of the kind of the bridge between the disc and the vertebra. But also we can look at a dynamic compressive force, and that will let us check and see if we have any unstable joints in the spine. So the way we do that is what we call a heel drop test. So what we need to do is be nice and relaxed. We're going to come up onto the balls of our feet, and then we're going to drop our heels into the floor nice and hard. So we make like a into the floor with the heels. It's got to be like that. What a lot of people will do when that is they'll kind of do this and then just like sloppily soften their knees. But what we've got to do to get a good test out of it and a good result is to come up nice and relaxed and then drop to get that into the floor. So what that will do is it will basically send a shockwave from your heels that will go through your spine segment by segment. And if there's a section that's loose or unstable, that section of your spine isn't going to react quite as quickly as the other sections. As that force goes through, there'll be a slight delay in its reaction, or it will move a little bit too much. And that will give you like a sensitivity. It will sort of like peak, and then it will drop off. Some people, if it's very severe, they'll almost get like a nauseous feeling, their knees will kind of buckle, and then it will subside. So if we get that kind of reaction, we know that potentially there's a instability in the joint. So what we can do if we suspect it's instability is we can just test by adding a little bit of abdominal brace. So if we find our belly button, we rake out sort of 5 to 6 inches to where our obliques are and fight our fingers and still be able to breathe. That's what we call making a brace. So if we run the test again with a bit of a brace, so we come up and then drop. And if we notice that suddenly improves the situation, by adding that layer of stability, we've now stabilized that joint. So that lets us know pretty clearly that we have an instability issue. If we added that brace here, and usually what happens as soon as you add the brace, people feel worse because of that kind of extra compression that's adding. That's a sign that someone's got more sort of end plate style compressive damage. So again, there's other tests we can sort of work from there just to kind of clarify that. But for this one, if we know we get a positive change with the heel drop and that brace is absorbing some of that instability and locking things together, we know that person has an issue with an unstable joint in their spine. So again, very important before we sort of prescribe a plan or solution, we investigate the problem thoroughly first of all, understand what's going on, and then that underlines everything that we're going to do going forward in terms of not just exercise selection, but also things we need to be careful of in day-to-day movement habits. So the heel drop test can be a very useful tool just to help us check and see if the problem is instability. So again, that test gives you an idea that's going on. So what does that mean in terms of your plan going forward? So what it does, it lets us know what we need to do and also what we need to avoid. So what we need to do is build stability around that joint. So things like McGill's Big Three is probably going to be one of the better starting points for that particular person. It also means that we've got to be very careful. We basically need to avoid doing any stretching or massage or release work for that person, because the things that are going to feel tight are actually your body's kind of desperate attempt to sort of generate some stability. It just happens to be overusing kind of the wrong muscles to do that job, which is why those muscles feel kind of tight and grouchy all the time. The trouble is if you force those kind of emergency guy wires to let go, you're then making the underlying problem far worse, which means at best you end up just sort of chasing your tail. Like you'll get tight, have a massage or stretch, kind of gets loose and then it comes back again. There's a danger it'll actually make your problem worse. And I've had things before where people have, unbeknownst to me on the weekend, I felt a bit stiff and grouchy, so I went for a massage, and then the next day they literally couldn't get out of bed. And I get like an emergency phone call on a Saturday morning or a Sunday morning saying they can't get out of bed. And my first question is, did you go for a massage or do some stretching by any chance? And that's kind of what will happen. That's the danger of if we use the wrong tool for the wrong person. So again, provocation testing, very important. It lets us zero in on what's actually going on, and kind of dictates and shows us very clearly what we can and cannot use for that person. Because what we need to do with back injuries is not just randomly guess and just throw generic stuff at each person, because there's always a danger, even with the best intentions, you're going to throw the wrong solution at the problem and make the problem worse. So running tests and provocation tests, very important so we get clarity of the mechanics as to what's going on, and that lessens our chance of making mistakes, and also greatly enhances our ability to get success as early as possible, because that's what we want for our clients, is we want them to get on the right path as quickly as possible. And I usually say to my clients, for a good yardstick, if you're on the right plan and you're honestly following it the way that you should be, you notice an improvement within a few days. It's not going to take weeks and weeks and weeks unless you've missed something somewhere, like an aggravator potentially, and not quite fully understand the mechanics of what's going on. So again, provocation testing, very important part of a successful rehab program for back injuries. And again, before you propose a solution to the problem, you have to be 100% sure you understand the problem at hand and what's actually going on. So again, a few simple tests, a bit like the heel drop test, a few others that we can run. We can zero in on exactly what's going on, and that then dictates what we can and can't do and what solutions we actually need to use.